So in our last PowerPoint, we focused on understanding the process of inspiration and exhalation. Now we're going to be taking a look at the volumes and capacities of the lungs as a result of inspiration and exhalation. So this is going to be your favorite graph for this part. You do need to know all of the components of this graph, so let me explain it to you. We're going to start by looking at the volumes, starting by the middle one, which is one of the small ones, which is called the tidal volume. Tidal volume is the amount of air that is being exchanged every time you take a breath. So if you're moving upward, that's implying the inspiration because you're adding volume, right, to your lungs. And as you start to exhale, you're basically going to remove that air. So this part of the graph represents your exhalation. So this whole thing, as this little bump that you see, this is referred to as tidal volume. And in an average healthy male, the amount of air that's being exchanged every time you take a breath is about 500 milliliters. Now, if you take your normal inspiration, which is this part, and then you continue to inhale, you basically fill up your lungs to the maximum capacity. So this part is referred to as inspiratory reserve volume, basically how much air you can reserve by taking a deep breath. The number that you're looking for is about 3,100 milliliters, which is also very important for you guys to know. So this is the maximum capacity of the lung. Now you can take that volume, basically exhale out. You can take a normal breath that you can see right here. And then you can, after you did your normal exhalation, you can continue to exhale, which means basically remove additional air that you would normally normally keep in your lungs. So this is the reserve that you're getting rid of through expiration. So we refer to that as expiratory reserve volume, and it's about 1,200 milliliters. Do notice the green portion of your graph on the bottom? Notice that this part is not part of your graph, neither inhalation or expiration. This is known as the residual volume, which basically implies any amount of air that lingers inside your lungs and your air passageway, and it doesn't matter how forcefully you want to exhale, there will still that amount of air will always stay inside the lung, and that's about 1,200 milliliters. Now these are your volumes. So what are your capacities? Now the amount of air that you can basically bring in every time is the combination of your normal breath plus the inspiratory reserve volume is called inspiratory capacity, basically maximum capacity of inhalation. It's about 3,600 milliliters. The amount of air that is going to stay in your lung after your normal breath is a combination of your ERV, or your expiratory reserve volume, plus your residual volume, which is called the functional residual capacity. It's residing inside your lungs, and you can use it basically as a source of oxygen. And that's about 2,400 milliliters. And all of the air that you can basically move in and out of your lung, which is IRV, tidal volume, and expiratory reserve volume, is referred to as the vital capacity. That's about 4,800 milliliters. Total lung capacity is all of the air that is inside the lungs can be gained or lost through expiration and inhalation. The total lung capacity is about 6,000 milliliters or 6 liters for a healthy adult male. Now, why do we focus on these? There are two types of disease that you guys really need to know, and these are the two main branches of the pulmonary disease. The first one is called the obstructive pulmonary disease, and this is when your air passageway has been constricted, which means air resistance is high, and air will stay inside your lung instead of being able to move out of your lung. This means that your capacities, total lung capacity, for functional residual capacity, and your residual volume are all going to be high because the air stays in your lungs and cannot get out. The diseases that are associated or considered to be obstructive pulmonary disease are emphysema, bronchitis, and asthma. And you learn about them as we go through the disease of the respiratory system. Restrictive pulmonary disease is opposite of obstructive. This decreases the lung capacity because there is either a mucus built up, fluid built up inside your lungs to prevent enough air to stay inside the lung. That causes all of the volumes and capacities to decrease. Disease such as cystic fibrosis, which is basically an inherited condition where you produce a significant amount of mucus, tuberculosis, which is basically a bacterial infection. All of these causes fluid built up in your lungs, and as a result, you limit the ability to carry air inside your lungs. So how do we distinguish, in a sense of tests, to diagnose obstructive versus restrictive pulmonary disease? So there is a test that you can do to figure out forced vital capacity. Forced vital capacity is how much air you basically can get rid of in your lungs. Now this is a really good graph. We're gonna be more familiar with it during your lab, but for now let's understand it. The curvature you see right here, it represents the amount of air that you get rid of in your lungs during 3 seconds. This is basically you forcing as much as air out of your lungs. Forced expiratory volume 1 is what you can get rid of your lungs in 1 second. So this 1 implies 1 second. So this number, if you figure out what it is, it's about 80% of the total lung capacity will be removed in the first 1 second, and all of it should be done in about 3 seconds, which is basically where you hit your plateau. So forced vital capacity, what you see here, is the amount of air you basically forcefully exhale. You should be able to get rid of all of the airs in 3 seconds, but 80% of that air would be removed in the first second. So keep that in mind. So that's 1 second is referred to as FEV1. So if you have obstructive pulmonary disease, which basically means air cannot get out of your lungs, your FEV1, right? The 1 second, because you can get rid of the air stays in your lungs. So you would be less than 80%. So your FEV1 would be less than 80% of your total capacity for your person. However, if you have a restrictive pulmonary disease, you have your forced vital capacity being smaller than your predicted FVC. So what does that mean? Remember that I said your lung capacity, depending on your age and gender and other characteristics, can be different. So we have lots of charts that gives us this predicted forced vital capacity based on our age, gender, and height, etc. So if the number we're getting in that 3 seconds after we take this breath, if that number is smaller than what is predicted for our age and gender, etc., that means you have restrictive pulmonary disease. That means your lungs are not carrying enough air. Opposite is also the other way is obstructive pulmonary disease. You want to get rid of up to 80% of the air inside your lungs in the first second. So if that number, if FEV1 is less than 80%, that implies that you have an obstructive pulmonary disease, which means it's preventing air from leaving your lungs. Here's basically the equation. So you have FEV1, if you want to figure out your capacity. If you're a healthy individual, you have FEV1 minus FVC times 100 is equal to 80%. But if your FEV1 is less than 80%, you have an obstructive pulmonary disease. and if your FVC1 is, if your FVC1 is smaller than your predicted, you have restrictive pulmonary disease, which means, again, your lungs do not have the ability to carry as much air. So let's finish up by looking at some of the medical conditions associated with your respiratory system. We mentioned this, so let's take a look at them. Emphysema is when it's a chronic condition, it gets worse over time. Biggest problem is that you have a decrease in surface area of the lungs. So lots of surface area. This is a normal heart. This is a person with emphysema. You can see the cavities are much larger, which means the surface area is much smaller. This affects your external respiration because now you have limited surface area, which means the exchange between your lungs and your blood vessels would be limited. And also you have a reduced elasticity of the lung. Remember I said lung is very elastic, which means if it loses its elasticity, it cannot basically exchange air effectively between the atmosphere and the lungs. And the problem with this is basically you can bring air in, and when the air comes in, you have very limited surface area. To resolve this issue, the best way is to basically get a lung transplant. We also have infections, result of the bacterial infection, where you have, it's known as acute bronchitis, where you have inflammation of your primary and secondary bronchi. Basically, the main branching of the bronchi coming into the lungs is inflamed as a result of an infection. The problem with this is, with acute bronchitis, is this, that if people who have an infection do not take care of that infection and basically search treatment and take care of their health, you make yourself more susceptible to secondary bacterial infection. These are opportunistic infections that can expand and spread through the rest of the tissue and cause pneumonia. So pneumonia is either a viral or bacterial infection that affects the lungs, more specifically your alveoli, where your gas exchange takes place. It fills it with very thick fluid, so it significantly affects the external respiration, and again makes it very difficult to breathe and exchange gases between your blood and your lungs. There are symptoms including high fever and chest pain, which are typical signs of pneumonia as a result of the infection. Asthma is another typical respiratory disorder. It targets the bronchi and bronchioles, so basically the branching of the bronchial tree. What happens in these individuals is that you have a tissue that is basically inflamed. So if you take a look and compare this is a normal healthy bronchi. You have a very open passageway, right? Air can easily get in and out. But here what you see is this tissue surrounding this is highly inflamed, which means it's limiting the passage of air through that air passageway. You also have this yellow buildup, which is the mucus buildup, which further closes and clogs the air passageway. Now, if this person is exposed to an allergen, which is basically something that triggers an asthma attack, such as pollen, dust, tobacco smokes, exercise, and other components, an asthma attack takes place, where these muscles, these smooth muscles you see as these strips around the air passageway, is going to constrict. And it's going to even make the air passageway even smaller than it was before. This traps the air inside the lung and basically makes the person gasp for air. The best way to treat a person with asthma attack is to give them the fast-acting inhalers, which controls the muscle spasm. The fast-acting inhalers stop the muscle spasm and allows the air passageway to open up a little bit. You also can take medication on daily or weekly basis, which controls the amount of inflammation and mucus buildup in the tissue to make sure that the air passageway remains open. Lung cancer, I don't really want to focus on that, but you do need to know that it has the ability to metastasize to other parts of the body, and as a result, if a person is identified with lung cancer or diagnosed with lung cancer, typically they remove the section of the lung that has been been affected. Um, so and they also treat the person with radiation and chemotherapy. People who do smoke, people who are in a very polluted areas, have damage to the lining of the respiratory tract, which means that their pseudostratified ciliated cells will not be able to effectively function. As a result, you make your cells more susceptible to become abnormal and develop to cells that can be eventually become cancer cells. Best way to treat it again is to remove the lobe of the lung that has been affected. You can also undergo radiation and chemotherapy to deal with or to prevent the lung cancer from spreading to other parts. We'll continue with the other aspects of the respiratory physiology in your next PowerPoint.